How does hepatitis B spread between people? Imagine a tiny virus that can quietly move from one person to another, often without obvious signs. That's what hepatitis B does. It spreads mainly through contact with infected blood, semen, or other body fluids. The most common way is through unprotected sex. If you have sex without protection with someone who carries hepatitis B, the virus can enter your body through small cuts or mucous membranes. Both heterosexual and homosexual activities are potential routes for transmission. Another major route is blood-to-blood contact. Sharing needles or syringes during drug use is a high risk because infected blood can easily pass from one person to another. Medical or dental tools that aren't properly sterilized can also be a problem. If equipment like scalpels, razors, or dental instruments are contaminated and reused, the virus can spread. That's why strict sterilization procedures are vital in healthcare settings. Pregnant women infected with hepatitis B can pass the virus to their babies during childbirth. This mother-to-child transmission is especially concerning because infants infected at birth have a higher chance of developing long-term, chronic infections. To prevent this, healthcare providers often give newborns hepatitis B vaccines and sometimes immunoglobulin injections right after birth. Activities involving skin punctures or sharing sharp objects can also transmit hepatitis B. Getting a tattoo or body piercing with unsterilized equipment, or sharing razors, toothbrushes, or nail clippers that may have blood on them, can put you at risk. It's important to use sterile tools and avoid sharing personal items that might carry blood. Hepatitis B is not spread through casual contact like hugging, shaking hands, or sharing utensils. It's not transmitted through coughing, sneezing, or sitting on the same toilet seat. Saliva alone usually doesn't carry enough virus to infect unless it contains blood and comes into contact with an open wound or mucous membrane. Prevention is key. Vaccination against hepatitis B is the most effective way to protect your liver and reduce the risk of developing liver cancer linked to chronic infection. Safe sex practices, avoiding sharing needles or personal items that may have blood, and screening pregnant women are all important strategies. Understanding how hepatitis B spreads helps us take smarter steps to stay healthy and keep our communities safe. Always consult healthcare professionals for personalized advice and vaccination options to keep your liver in top shape.